Hi, I'm Jason Bellamy, back here at CSM 2014 with another dispatch from Las Vegas. We talked previously about some of the conversations that are happening here. We had a federal update on the national level, but there's also state issues being discussed, and to that effect we have Kip Schick of Wisconsin to talk about something that's coming up there. Tell me about this piece of legislation that you're bringing forth in Wisconsin.
Sure. We just introduced legislation in the Senate and in the Assembly in Wisconsin that would amend the radiologic technologist scope of practice to allow them to accept an order from a physical therapist. Under current state law, a radiologic technologist cannot accept an order from a physical therapist. It stipulates certain types of providers. Those include physicians, dentists, chiropractors, podiatrists, advanced practice nurses, and physician assistants. And so over the past 10 months, we've been working internally with our members, with our leadership, external stakeholder groups, as well as legislators to get this legislation introduced. And once enacted, it would allow a radiologic technologist to accept an order from a physical therapist for plain film x-ray.
Okay, so that's what's being introduced. Why? Why go this route? Why is this important, in your opinion, for the physical therapy profession moving forward?
Sure. In Wisconsin, we've had direct access since 1987, and we have a lot of physical therapists around the state that practice in a direct access model. And certainly, as part of that practice model, oftentimes a physical therapist is evaluating a patient for a condition which is where that patient has not been seen by another healthcare provider. And as part of the evaluation process, physical therapist is determining what types of tests and measures might need to be done, and x-ray is one of those tests and measures. Under current state law, a physical therapist has to refer the patient to another medical provider to get that x-ray performed. And there's several things that happen when that occurs. It delays care, which is not in the best interest of the patient, and it also adds expense for the patient because they're going to have an office visit with another type of medical provider. And so we believe, and this is really why we introduced the legislation, that we need to meet the 6 domains that are part of the Institute of Medicine for the delivery of care. That includes that the care is provided safely, timely, efficiently, effectively, equitable, and patient-centered. And we believe this legislation does that.
Great. So let's play a little bit of crystal ball. If this passes, do you think there could be a potential trickle down to other states? You know, again, we don't know yet, but what do you think the impact could be of this bill?
Well, it certainly could. We certainly believe that, and in my mind, it's not an if, it's a when. When we get it passed, I think that what you'll see in other states is there'll be other components that work with their membership, different stakeholder groups, to introduce the same type of legislation, really for the reason that that we're contending. I think it's not just direct access, but I really think direct access is a model that, as frontline providers, we're the entry point for patients, that this is something that really streamlines care and really is something that providers, certainly in the physical therapy community, but I think our patients more importantly will want.
So again, these are the kind of conversations that happen at a national conference like this. To see other dispatches, to hear some of the other conversations we've had, go to apt.org/CSM/video. He's Kip Schick. I'm Jason Bellamy, and I'll catch you next time.